What is WBC blood test? A WBC count is a blood test to measure the number of white blood cells, WBCs, in the blood. It is a part of a complete blood count, CBC. WBCs are also called leukocytes. They help fight infections. There are 5 major types of white blood cells: Basophils, Eosinophils, Lymphocytes, T cells, B cells, and natural killer cells. Monocytes. Neutrophils. How the test is performed? A blood sample is needed. How to prepare for the test? Most of the time, you do not need to take special steps before this test. Tell your healthcare provider the medicines you are taking, including the ones without a prescription. Some drugs may change the test results. How the test will feel. When the needle is inserted to draw blood, some people feel moderate pain. Others feel only a prick or stinging. Afterward, there may be some throbbing or slight bruising. This soon goes away. Why the test is performed? You will have this test to find out how many WBCs you have. Your provider may order this test to help diagnose conditions such as an infection, allergic reaction, inflammation, blood cancer such as leukemia or lymphoma. Normal results. The normal number of WBCs in the blood is 4,500 to 11,000 WBCs per microliter, 4.5 to 11.0 times 109/L. Normal value ranges may vary slightly among different labs. Some labs use different measurements or may test different specimens. Talk to your provider about your test results. What abnormal results mean? Low WBC count. A low number of WBCs is called leukopenia. A count less than 4,500 cells per microliter, 4.5 times 109/L, is below normal. Neutrophils are one type of WBC. They are important for fighting infections. A lower than normal WBC count may be due to bone marrow deficiency or failure, for example, due to infection, tumor, or abnormal scarring. Cancer-treating drugs, or other medicines, see list below. Certain autoimmune disorders such as lupus, SLE. Disease of the liver or spleen. Radiation treatment for cancer. Certain viral illnesses, such as mononucleosis, mono. Cancers that damage the bone marrow. Very severe bacterial infections. Severe emotional or physical stress, such as from an injury or surgery. An ethnic/genetic trait, not uncommon in African Americans. High WBC count. A higher than normal WBC count is called leukocytosis. It may be due to certain drugs or medicines, see list below. Cigarette smoking. After spleen removal surgery. Infections, most often those caused by bacteria. Inflammatory disease, such as rheumatoid arthritis or allergy. Leukemia or Hodgkin disease. Tissue damage, for example, burns. Pregnancy. There may also be less common reasons for abnormal WBC counts. Drugs that may lower your WBC count include antibiotics, anticonvulsants, antithyroid drugs, arsenicals, captopril, chemotherapy drugs, chlorpromazine, clozapine, diuretics, water pills, histamine 2 blockers, sulfonamides, quinidine, terbinafine, ticlopidine. Drugs that may increase WBC counts include beta-adrenergic agonists, for example, albuterol, corticosteroids, epinephrine, granulocyte colony stimulating factor, heparin, lithium. Risks. There is little risk involved with having your blood taken. Veins and arteries vary in size from one person to another, and from one side of the body to the other. Obtaining a blood sample from some people may be more difficult than from others. Other risks associated with having blood drawn are slight, but may include excessive bleeding, fainting or feeling lightheaded, multiple punctures to locate veins, hematoma, blood accumulating under the skin, infection, a slight risk any time the skin is broken.